Why is a specific sweep gas flow rate adjusted on the membrane oxygenator? A. To change the patient's core body temperature. B. To match the mechanical speed of the centrifugal pump. C. To primarily regulate the elimination of carbon dioxide, CO2. D. To increase the thickness of the blood. Answer: C. To primarily regulate the elimination of carbon dioxide, CO2. Explanation: on a membrane oxygenator, the fractional concentration of delivered oxygen, FiO2, controls oxygenation, while the total volume of gas flowing through the fibers per minute, the sweep gas rate, controls how much CO2 is washed out of the blood. What is the primary role of the cardiotomy suction line in the bypass circuit? A. To vent the left ventricle during aortic cross-clamping. B. To aspirate shed blood from the open surgical field and return it to the reservoir for recycling. C. To deliver high potassium cardioplegia directly into the coronary sinus. D. To apply vacuum pressure to the lungs. Answer: B. To aspirate shed blood from the open surgical field and return it to the reservoir for recycling. Explanation: cardiotomy suction lines actively vacuum blood up from the pericardial cavity and chest wound, routing it through a filter in the reservoir so that the patient's own shed blood is conserved and recirculated instead of being wasted. Which monitoring site provides the most accurate estimation of brain temperature during the rewarming phase of CPB? A. Rectal probe. B. Bladder probe. C. Nasopharyngeal or tympanic membrane probe. D. Peripheral skin probe. Answer: C. Nasopharyngeal or tympanic membrane probe. Explanation: nasopharyngeal and tympanic probes closely mirror the temperature of the internal carotid artery, making them highly reliable for tracking cerebral temperature and preventing accidental brain hyperthermia during rewarming. Bladder and rectal probes reflect core visceral changes, which lag behind. What type of cardioplegia delivery involves inserting a specialized catheter into the coronary sinus to protect the myocardium? A. Anterograde cardioplegia. B. Retrograde cardioplegia. C. Ostial cardioplegia. D. Systemic cardioplegia. Answer: B. Retrograde cardioplegia. Explanation: retrograde cardioplegia is delivered backward through the venous side of the coronary system via the coronary sinus. It is especially useful when significant coronary artery blockages prevent an anterograde, forward through the aortic root, flush from reaching downstream areas of the heart. If the perfusionist notes a sudden, sharp rise in the pressure line measuring preoxygenator pressure, where is the obstruction most likely located? A. In the venous drainage cannula. B. Inside or immediately downstream of the oxygenator/arterial filter. C. In the cardiotomy reservoir. D. In the left ventricular vent line. Answer: B. Inside or immediately downstream of the oxygenator/arterial filter. Explanation: the pump pushes blood forward into the oxygenator. High pressure before, the oxygenator signifies a massive downstream resistance or blockage, such as a clamped arterial line, a kinked cannula, or clot formation within the oxygenator fibers/arterial filter. What condition is highly correlated with long pump times due to systemic inflammatory response syndrome, SIRS, triggered by the circuit? A. Severe localized deep vein thrombosis, DVT. B. Pump head or post-perfusion syndrome, alongside vasoplegia. C. Acute hyperthyroidism. D. Immediate malignant hyperthermia. Answer: B. Pump head or post-perfusion syndrome, alongside vasoplegia. Explanation: passing blood through meters of synthetic tubing activates leukocytes, platelets, and the complement cascade, causing a systemic inflammatory response. This can lead to transient cognitive dysfunction, pump head, and vasoplegic shock. How does deep hypothermia, 28 to the power of C, alter the physical properties of blood within the CPB circuit? A. It drastically lowers blood viscosity. B. It increases blood viscosity and shifts the oxyhemoglobin dissociation curve to the left. C. It causes immediate breakdown of all plasma proteins. D. It completely stops blood from interacting with the oxygenator membrane. Answer: B. It increases blood viscosity and shifts the oxyhemoglobin dissociation curve to the left. Explanation: as blood cools, it physically thickens, increased viscosity, which increases resistance to flow. Hypothermia also increases hemoglobin's affinity for oxygen, shifting the curve left, meaning hemoglobin holds onto oxygen more tightly at the tissue level. What safety mechanism on the CPB machine will automatically stop the arterial pump if it detects an empty venous reservoir or air in the lines? A. The oxygen analyzer. B. The level sensor and ultrasonic bubble detector. C. The vacuum regulator. D. The thermal safety switch. Answer: B. The level sensor and ultrasonic bubble detector. Explanation: level sensors trigger alarms or stop the pump if the reservoir drops below a safe volume to prevent air from being sucked down. Ultrasonic bubble detectors sit on the arterial line to intercept and halt the pump instantly if any macroscopic air is traveling toward the patient. What is the fundamental difference between alpha-stat and pH-stat blood gas management strategies during hypothermic CPB? A. Alpha-stat corrects the pH calculation for the patient's cold temperature, while pH-stat ignores it. B. pH-stat actively adds CO2 to keep the pH at 7.40 at the patient's actual cold temperature. Alpha-stat measures the blood at 37 C without temperature correction. C. Alpha-stat requires continuous administration of sodium bicarbonate. D. pH-stat is only utilized during standard normothermic bypass. Answer: B. pH-stat actively adds CO2 to keep the pH at 7.40 at the patient's actual cold temperature. Alpha-stat measures the blood at 37 to the power of C without temperature correction. Explanation: pH-stat alters gas mixtures by adding CO2 to counteract hypothermic respiratory alkalosis, inducing cerebral vasodilation, often preferred in pediatric cases. Alpha-stat allows the blood pH to rise naturally as it cools when measured at 37 to the power of C, preserving intracellular enzyme function and autoregulation. During weaning from CPB, what does the term modified ultrafiltration, MUF, primarily accomplish? A. It cools the patient back down if they overheat. B. It concentrates the patient's blood immediately after coming off bypass, removing excess water and inflammatory cytokines. C. It serves as a secondary method to deliver heparin. D. It pumps air back into the venous reservoir. Answer: B. It concentrates the patient's blood immediately after coming off bypass, removing excess water and inflammatory cytokines. Explanation: MUF is performed right after the patient is successfully weaned off bypass. Blood is drawn from the arterial line, passed through a hemoconcentrator filter to strip away excess fluid and circulating inflammatory molecules, and returned to the right atrium, increasing the post-bypass hematocrit and blood pressure.